Hey there! If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation in Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
All right. So hi everyone. Welcome on Zoom. Give me a second. The video is playing again. All right. Okay, so thank you again for joining us here on Zoom, as well as those who may be watching on our live streams on Facebook and YouTube. My name is Julia Ocampo. I am from the SIHI Secretariat in the Philippines. And I hope that video sort of introduced you to the work of the SIHI network. So we're a global network of research hubs all over the world, and we're continuing to grow and now into more of the Caribbean region, which we'll be learning some parts about today. And I believe we're joined by registrants from different countries and from different organizations, and of course, are also from our SIHI hubs. So right now, please feel free to use the chat box to introduce yourself, and you can also share comments throughout the session. So before we begin, I'll just give some few house rules. So the first is just to sit back, relax, and let's keep a respectful session. And of course, let's take notes if you want to learn. Second is that audio and video abilities have been limited for security, but you can use the chat for questions or use the raise hand function so we can allow that for you as the session or as the question and answer session will occur later on in the session. And third is if you experience any technical issues, please message our team through the chat and we'll do our best to assist. Okay, and lastly, this session is being recorded and live streamed on SIHI's social media pages. So if you prefer not to be seen, well, the videos are off, so you won't be seen. But it would be great also if you could share to your friends and colleagues about this session happening right now. And you can also revisit the playback anytime once the session has been processed and uploaded on YouTube. Okay, so as the poster says, today's session is on ethical AI for climate resilience and health equity in small island developing states. So this session explores how ethical, locally informed artificial intelligence or AI can strengthen resilience by working at the intersections of disaster risk management, climate health, and social justice. So it introduces AI for SIDS, an innovative Caribbean-born open source platform designed not to replace, but to enhance and extend existing early warning systems. So I will leave that later to Lauren and Leticia to tell us more about AI for SIDS. Okay, so let's get the ball rolling. So I'll hand over the virtual floor to Dr. Lauren De Freitas from the University of West Indies St. Augustine campus in Trinidad and Tobago to open our program.
Thank you, Julia. Good morning, good afternoon, and good night to everyone. Thank you all so much for joining us today. So I am Lauren De Freitas. I'm the coordinator for SIHI Caribbean, and we are based at the Department of Public Health and Primary Care at the University of the West Indies in Trinidad and Tobago. So we are one of the newer hubs, and we're aiming to launch in January of next year. But this is one of our first activities, so we're really happy to co-host this talk on ethical AI for climate resilience and health equity in small island and low-lying developing states, which we know is very relevant to the Caribbean region and many other SIDS, as well as to other settings. I'm also pleased to introduce our presenter today, Dr. Leticia Addison, who is an educator and researcher at the University of the West Indies with over a decade of experience in tertiary teaching and statistical consulting. She leads award-winning projects at the intersection of AI, geospatial intelligence, and climate resilience, including the COP29 AI Innovation Challenge winning platform AI for SIDS, which is the focus of today's talk. She's also a senior fellow of the UK's Higher Education Academy and a Women in Data Science ambassador for Trinidad and Tobago. Her work spans data-driven modeling, disaster resilience, and education transformation. We're really happy to have her today, and we hope you all enjoy this talk. Over to you, Leticia.
Thank you very much, Dr. De Freitas, and thank you very much for having me today. It's really a pleasure to be here and showcase some of the work that I'm currently involved in and present to you. So let's get started. I will share my screen. I don't think I'm allowed to share currently. Let's see. Yes. Okay, great. Thanks so much. Okay, so jumping right in, today I am going to give a bit of a context to ethical AI for climate resilience and health equity in small island developing states. Here is just a short outline of some of the aspects that I will touch on today, really just as a nice introductory idea, and really some of the concepts that will come up can also be extended further along in terms of what this means for the intersection of artificial intelligence with climate change and health, which is quite an emerging field in the past few years. So we're going to touch on what climate change and health equity looks like in the Caribbean. Then we'll talk about what artificial intelligence can offer in terms of what is already existing, a bit of the use cases for climate change and health in terms of use of AI, and then look at a bit of the AI-driven resilience in the region, and more specifically, as the chairs have mentioned, the AI for SIDS platform proposal that my team and I had last year, and how that is shaping up this year, 1 year later, actually. I think it's actually an exact year later today. So really and truly is very exciting to show some of the progress that's being made currently, and then talk about the aspects of going from some sort of data-driven platform, being able to think about what that means for AI policy insights with all these intersecting areas, and then the call for action. So it's quite a loaded outline, but it's actually going to be a very nice introductory talk, and I hope you enjoy. So let's start off with Caribbean climate resilience in specific. Now, even though I'm focusing on the Caribbean because I'm from the Caribbean region, this applies to all the small island developing states across not only the Caribbean, but in other parts of the world, and also least developed countries in terms of what these impacts mean for us as they relate to increasing hurricanes, sea level rise, and floods. And in addition to that, we notice that with these impacts, we also have accompanying health impacts. And I'm really going to just focus on a few specific ones that come up a lot, especially when it comes to the rise in the heat rise, disease risks, and also food and water insecurity. Now, health systems specifically, most of the time, more reactive, and can also be in some ways under-resourced in a lot of these different countries. And what that means for us now, especially when it comes to thinking about the economic toll, billions in damages, and even that stress on the healthcare system. We need more predictive and adaptive responses. And I also like to say we need more proactive than reactive responses as well. So we need to actually think about what that looks like and how we can actually, shape up those types of ideas as we move forward into using more digital technologies. So let's speak a little bit about health equity risks in disasters. And I'm just saying at a glance because this is just a really introductory insight. So natural disasters specifically amplify existing health inequities, especially in vulnerable groups. I mean, you have these climate hazards that can occur, floods, hurricanes, heat waves. There is also access gaps that can happen with related to these impacts, poor infrastructure, limited transport, data blind spots. And then it also speaks to these unequal outcomes that can occur, clinic closures, disease outbreaks, delayed aid across rural zones, etc. Now, all of these cascading effects really do lead to a public health crisis, especially where there is, water insecurity and clear delays. It really overwhelms the health systems. There are traditional early warning systems, which, usually accompany get weather alerts and these types of, are related alerts across islands. But a lot of the times they may miss equity signals. For instance, sometimes what happens is the alert comes right before the impact is going to hit in terms of maybe torrential rain, or it comes too far before, and then sometimes persons, I'm not sure, minutes before or hours before, how to really, what is their level of risk in their specific zone. A lot of the times the alerts are just more countrywide, and we need to be a little more, forward thinking in terms of customizing these types of alerts. So a lot of the time, the early warning systems will miss some of the equity signals, and we really want to think about how we can use artificial intelligence not to replace your traditional systems, but actually to enhance what they are currently doing and enable us to anticipate who is at risk, not just where the hazard is going to strike. And I think that is super important, because with disasters, inequity really becomes very deadly. So there are a lot of multi-hazard early warning systems that are at play in various countries. But there are some gaps that are occurring, and we need to focus on what the gaps are currently to be able to understand how we can move forward to really make some improvements. So first off, we have a lot of them are focused mainly on physical hazards. So, when you have the hurricane, a pending hurricane, maybe, a rise in heat or even levels of flood risks. And we not necessarily focus on the accompanying health or social impacts that could occur once these impacts hit, which I think the public would really find very valuable to think about ahead of time. A lot of the time, there is also a lack of localized thresholds for actions. Now, we do have specific ways that we are supposed to react in terms of certain impacts that we face. For instance, we do understand, with earthquakes, stand in the doorway, these types of things. With floods, move to higher ground. But a lot of the times, we need more localized thresholds, especially when we come to more underlying areas or rural areas where they may need a little more care and probably more, actions to take in those particular events. Another issue that we face is also the data systems that are currently running. A lot of them are very siloed. They are really and truly, you have them working in isolation. And of course, the news stories would come out about these news items in terms of the data that's, the meteorological officers and these places have, the ministries. But in terms of coordinated responses with all of them at once, disaster risk professionals and all of these persons all together, a lot of the times the systems are so, singular that the coordination probably tends to come more so when the event actually happens or in terms of reacting to the event rather than coordinating ahead of time all together. Now, it's not to say that it doesn't happen in some places where they do coordinate all together, but a lot of the times, most of these countries face these problems. And then, of course, what this leads to, especially if they are more siloed, is there's limited community input then into system design, because the users who really and truly should be part of that design are more isolated from the process, and they receive the information after rather than beforehand, where they can actually give inputs into how it's actually impacting them and helping them. So with that said, what can artificial intelligence offer in such a space? Well, I first wanted to give persons who may know the term artificial intelligence but not be really familiar with the more specific aspects of the different domains. I wanted to just touch on that for a minute. Now, artificial intelligence itself has been around for more than 50 years, to be honest. But in the last few years, what we have seen is that there has been a rise in the use of artificial intelligence towards more generative aspects, where we can actually have systems that are more intelligent and more autonomous, that could quote unquote think for themselves, or give inputs and really give a space for getting insights that seem to be like almost like getting that from a person in some ways, in some aspects. Now, before we get to how that works, maybe for a system like probably in the SIDS regions, as I will talk about later, let's first think about AI for short in terms of the domains and the decisions. So artificial intelligence will allow us to make data-driven decisions based on data. And that in itself is important because we need to have adequate and abundant data for these systems to drive robust and accurate predictions. And as I said before, one of the main things that I think it's going to really achieve is help us in various domains to shift from reactive to proactive systems. So some of the key domains that we have currently are machine learning, we have computer vision, natural language processing, geospatial AI, and AI-enabled Internet of Things or IoT devices. And just to give you a quick context of each, machine learning can be used for forecasting weather and health risks. Computer vision currently can be used for satellite imagery and analysis. Natural language processing can actually be used for, especially when it comes to data mining and using text to really get insights for policies. Geospatial AI is really, and geospatial data itself, it's really a huge area that is actually really an integral part of this entire space, which is linking spatial data and having that linked to health outcomes. And spatial data is really important now to link to the different aspects that we have in terms of some of the climate variables that we have in each of the countries, for instance, rainfall, temperature, etc. And then we also have Internet of Things or IoT devices, like for instance, river gauges and sensors. And there are also AI-enabled ones that allow for climate sensor integration in spaces where persons want to measure the river levels and sensors for different aspects, maybe heat rise, etc. And what this does is that supports forecasting, resource allocation, and early warnings. And that's really a huge space to be in and a huge impact that it can have. Now, let's take this to how it looks in action in terms of global use cases, and more specifically, let's hone in on some of the aspects in terms of the health space, or the public health space, rather. So some of the global benchmarks, I would mention some of the use cases that are currently in play. For instance, malaria prediction in Africa. AI models are used to forecast malaria outbreaks from mosquitoes. Flood forecasting in Bangladesh. AI systems predict flood risks. There's also wildfire mapping in California, AI-assisted wildfire risk maps. And very recently, actually, when California had a lot of wildfires a few years ago, they built an AI app that was able to, persons in the areas were able to send pictures of the wildfire into the app, and then family members could actually access the app and be able to see what was going on in real time, which is really important. Then it's also urban heat mapping in places like Australia. So I'm mentioning some of the bigger countries so you can see what's being done currently in terms of AI identification, especially in terms of heat, which is also an emerging area. So in all of these, you could see that it could predict these outbreaks using rainfall, temperature, and all these different satellite imagery, provide early warning systems for extreme weather, and then, of course, satellite data and even crop or water quality. It's really very useful in these types of disaster response planning. Now, in terms of the Caribbean, and we call the Caribbean community CARICOM for short, which engages all the different islands, the chain of islands in the Caribbean, including Trinidad and Tobago, where I am from, we want to think about what that can mean for some of our use cases. And this is scalable to other parts of the world or other least developed countries, SIDS and other least developed countries as well. So I'm just pointing out a few here in terms of climate smart forecasting, the AI-informed mosquito control, and even climate risk assessments. For us in our space, I'm just identifying some key gaps and strengths that we have, and then the potential and the types of response. A lot of the times when we want to do smart forecasting, we definitely need stakeholder collaborations, because currently there are data gaps that are happening in different islands. Because different islands, I think 40% of SIDS actually have early warning systems that are up and running and up to date. So that means that we need to really improve those systems, and of course the gaps that exist in the infrastructure. Also the expertise. The strengths that we have, especially as a CARICOM or Caribbean communities, that we can engage regional cooperation, especially in this region where a lot of us face the same types of impacts. And that I think is really a great strength for us to be able to scale to different islands, of course, with some diversity involved in terms of the differences in the islands. And then, of course, we do have the existence of mobile technology and apps and these things, especially in different spaces. Of course, mentioning as well that in terms of equity, we also have to rethink that in terms of spaces that may have low internet connectivity, etc., especially when it comes to vulnerable populations. And then another potential that we have is to strengthen the early warning systems and optimize emergency response, particularly in the disease forecasting and smart agriculture areas. So in terms of AI applications and the public health links, let us think about more adaptive strategies and what that can look like. So I'm pointing out a few here for food for thought for our audience to really think about how we can extend these and what sort of cases we can really hone in on. So for instance, the predictive analytics for climate and health risks, we can use this to really anticipate the disease outbreaks, heat stress, water-related illnesses before escalation. One of the areas that I'm working currently in as well is trying to look at more real-time environmental monitoring using machine learning and Internet of Things, and really and truly using these sets of algorithms or instructions that can help us to predict or track air or water quality, for heat waves, for vector breeding conditions, and how do we do that in real time with the data that's currently available to us. Also, we have AI-enhanced decision support for policymakers. We want to think about evidence-based planning for health services, emergency responses, and also vaccination. So we want to look at this in a real holistic sense with respect to the public and also what these systems, what the management systems and ministries need to really enhance the approaches. We also think about optimizing resource allocation. We want to ensure timely and equitable distribution of medical supplies, emergency kits, and staff. And also, in that, education is important, enhancing public awareness and planning. And that really powers the early warning alerts and, of course, the health campaigns. That is really where we want to take all of this. Now, how does this fit into resilience? How does AI fit into resilience? And I want us to think about, before we just go very blindly into saying, because artificial intelligence exists, that we must use it, how do we really see this framework developing in terms of the integration aspect? I want to think about three main areas, which is really predictive, adaptive, and evidence-based. I think those are the three pillars of what I think should go into something like this. And I have a little bit of a flowchart here just to give a context of what it can look like, where we integrate climate level data as well as public health data using artificial intelligence applications, and also really getting the outputs that I mentioned previously with respect to the predictive modeling, disease surveillance, and risk assessments. But also, in addition to that, having these funnel into climate resilient health policies and outcomes, and particularly in our early warning systems and adaptive strategies, enabling us to go from data to AI models, to risk assessment, to policy and community action. Now, what does this mean for equity and ethical AI? Because we spoke about how it can be used, we spoke about the use cases, but let us speak more specifically about the key principles that we require, especially in terms of early warning systems. We need to engage vulnerable populations, particularly people with diseases as well, disabilities as well. account for the risk disparities by gender and also socioeconomics. And we also need to respect cultural norms and languages in messaging, super important. And then support the local capacity through inclusive processes. Because if we want AI to work for us, we must recognize that AI must respect the data rights, privacy, and also the community knowledge that is there for us to enable these systems to work very equitably. So I come to the point now where I can speak a little bit more about the AI for SIDS proposal, which was the winning proposal at COP29 last year. And also, I must mention as well that I'm very privileged to be a judge this year for COP30, and we also had a winner from Los Leos Islands, I believe, and she has also been developing one for smart agriculture. So we have a lot of persons in this space doing really lovely and phenomenal set of work in this area. So more specifically for AI-driven platforms, what we wanted to look at, and I really want to tell you a little bit behind how this idea was born. I have been working in the space of climate resilience for about probably 4 or 5 years, and then with the advent of looking at generative AI, started to have an understanding of how that can work for us. Where this proposal came from really started from a very simple place. I was looking up for information on reports from Trinidad on flood monitoring and flood risk. And I felt like there were a lot of reports that had a lot of PDF documents. And it was sort of a little bit more challenging to sort of bring all the PDF documents. This was about 2 years ago, into one space before, of course, generative AI and all these large language model platforms exploded. And with my team, with my research team, I mentioned to them, how do we make this easier to grasp and get the information that we need? Because in addition to data on the outside, with respect to maybe rainfall and all of these other variables, PDF documents from ministries have a lot of historical data and information that's really important for the understanding of, say, flood resilience specifically. So in that, we said, let's sit down and think about maybe creating a large language model to be able to capture that, a customized one. And from there, it spiraled into thinking larger. So when this AI challenge came up, I actually saw it on LinkedIn at the time, and I was very intrigued because they specifically focused on SIDS and least developed countries. And so said, so done, entered our proposal, really extending it and thinking about maybe going even further. So we were thinking about flood risk, but we said, what, this can work for, all different disasters. How do we form an AI-powered decision support platform where we can have forecasting, early warnings, and even planning in one space for different players in society? And also, I think for us, especially in Trinidad, thinking about Trinidad specifically, we needed more real-time analytics because we do get the reports of, say, a weather system that's occurring. But a lot of the times, the reports may be maybe 2 or probably 3 hours before telling us we would have specific rainfall happening that day. And sometimes closer down, persons in different areas need more information. So we wanted to include analytics and adaptive tools, predictive models, generative AI for speech to text, to get citizen feedback post-disaster, pre and post-disaster, and also have like a community feedback loop. So in that, we wanted to create a space that is really serving the entire community, from maybe the fisherman who is trying to, get some catch for the day before this, impending storm, to the farmer who's trying to protect his crops, to the citizen who's trying to get out of the town space where we say, where one drip of rainfall is floods, and then to disaster management professionals and health professionals who probably want to be able to get a context of the damages that could occur, and then, of course, the losses and the finances that would be required. So all of this, I know that's a very loaded slide now, thinking about it, but all of this is incorporated into thinking about how this idea can emerge for more real-time, localized disaster response and resilience. And in this, we thought it should be autonomous, adaptive, and agent-based. So we wanted it to be able to eventually have enough data to be able to train that data and learn from it, and then, of course, be able to give viable responses for persons to interact with it. And I'll show you in a second how a test version of that looks currently. But more so, we also wanted to understand how we can scale this and make it customizable for regional integration. So for instance, at another point in the phase of development, we would want to incorporate more speech to text for persons. Most of us speak English in the Caribbean, but some persons, have different dialects and the ways that we speak. So it would be great to have speech to text tools to be able to, decode some of that if we get feedback from persons after disaster, and then have all of that feedback. The community feedback would be vital. It's not just about using the information or the data from the climate level side. We want to be able to get feedback and actually funnel that into what happened last week in this flood, what happened in different areas for these vulnerable communities, what was the feedback of the citizens, and bring that back into a system. Of course, that's no easy feat, I would tell you, but I can also tell you, I'm happy to say that we are currently coming to the end of our first development stage, where we are now thinking about, how we can have a platform work, very simply with base level information, maybe information from social media, satellite data, rainfall, even some text in terms of, probably the aspects of what's happening in the space currently with respect to the weather reports, and then funnel that into this particular platform and see how it can work all together for flood risk use cases, which is a point where we want to scale. We eventually want to engage with our stakeholders in Trinidad, disaster management professionals to show them how this works. So on the screen, I'm just showing you a quick prototype. This is actually still in development stage, and we coming to a point where we are also going to look into deployment soon. So in early January, we can have this work for us and get feedback from the citizens and the public. So I'm just showing you the video has no sound, so I'm just speaking through the aspects of what we have on such a platform currently, which is we are really looking to have a space where we can bring in all the different weather reports and climate impacts, as you could see in different areas in Trinidad, and really give an idea in real time of the risk levels and predicted risk levels depending on the specific conditions, river levels, weather conditions, etc., and maybe give risk levels of critical, high, moderate, and as you could see, we even have a 7-day flood forecast so that you can actually have all of that in one space with respect to the critical conditions, river levels, storm systems. But more than that, what we wanted to integrate into a large language model component as well. So we're taking the weather components, and you could see here, it's just showing you some of like the active alerts, notifications that can occur. Once we have the data from these river gauges and these things, we can actually have them inputted into the system. And then we can also have preparedness resources that we will also funnel, as I will show you in a second, into a large language model system. And we want to be able to have this accessible to even researchers, disaster professionals, and eventually the public. But of course, this is a phased approach. So we have to first start with disaster management professionals and enable them to enhance their current systems. Here is the current system we are working on, and I'll tell you in real time, we're still in the development stage to actually deploy. And one of my web developers this morning said that we were able to get some of the system deployed in terms of the feedback. We do a lot of testing to see if it's giving the right information. As you would respect, large language models do have hallucinations, and we need to ensure that the data that comes into this is going to be accurate as it comes back out, or at least, with a certain level or percentage of accuracy. Of course, with a disclaimer that some of the information can also hallucinate at certain times. But right now, this is where we are in the space with creating such a large language model and preparedness assistant to be able to go with the system. It will also have information that is readily available on the outside in terms of, what sort of probably flood risk is occurring in a specific area or region. So vulnerable regions can have that information, particularly disaster professionals, and then they can see where the regions are. It will be flagged. They can log in. And the disaster management professionals could actually get a little more of a context if they want to do some specific predictions. As you could see here, we have a few graphs with like the rainfall, river gauges, and we do recognize that a lot of them would have access to this data, which is why it's so important that we have these conversations so that they can know that we can probably funnel a lot of that data into one space to be able to have it work for us and for the public. So this is just a little bit of a real-time approach, and I'm really happy to share it in its current form, but of course, letting you know that it's also going to be improved as we go along. And of course, eventually, hopefully, we can do more of a public type of showcase. So this is where we are with the disaster system. And as I said, you can have there's a little preparedness assistant there where persons can really interact and really get further information. So moving right along, what I wanted to point out now is that this is just a general system that we built into the base system for looking at flood risk and what's occurring currently. What we want to do is elevate the system to actually include public health alerts as well. So as I mentioned previously, we have a lot of siloed systems happening. Everyone has data in some way or form that's being accessed by the public in some form. But we want to be able to include that in such a system and build infrastructure that is, especially data infrastructure, that's going to be useful. So I put a scenario here, for instance, I put a specific area in Trinidad, we have in South Trinidad. And if we have a scenario of flash flooding and maybe leptospirosis risk, what we would want to do with the system as we build it along is to ingest that real-time data. Maybe the rainfall forecast, maybe they said is above a certain level, a threshold. We would ingest both satellite data, looking at the cloud formations, etc., and really understanding where the rain is happening most. River gauge data, local social media reports of flooding as well. And apply thresholds co-developed with local actors, particularly with the Disaster Risk Management Agency, to look at geo-targeted flood warnings for, say, the two areas, Pinal and Debe, looking at the public health alerts that can happen in terms of maybe the messaging related to the risk of leptospirosis regarding rising floodwaters and letting people know, because sometimes we tell persons avoid floodwaters because of course they could be swept away. A lot of the times the messaging doesn't tell them, there's a very high risk of leptospirosis in this area because of the fact that the floodwaters will be rising, the animals that would be traversing these spaces, etc., the diseases, all of these things I think are super important. And then this can really go into a public health system resilience infrastructure in terms of proactive governance and really having all these systems support each other. So what does that mean? And especially building equitable systems, what we need to think about currently, which is really very, very important, and I will say in this space, integrating these types of systems, especially when it comes to data, privacy, large language models, all of these aspects, we need to think about anticipatory governance when using AI. And co-creation with governments and communities is very essential to the process, particularly for the vulnerable communities. We need to also have more transparent, explainable decision-making logic so persons can understand how the systems work. A lot of the times persons don't understand because they are black box systems. And I'm happy to report that the system we are building, we are actually creating, myself and some of our very talented graduate students at the University of the West Indies, including Professor Patrick Hussain, my dear colleague, who is also supervising this work. We are actually building the system, at least at this point, from scratch to understand what's happening behind it, because we are the persons in the region. We need to understand what's happening in these algorithms. Also promoting inclusion of vulnerable and underserved populations. Maybe going out and testing with them, getting feedback, as I mentioned, the feedback from them on what challenges they face when these disasters hit and how we can support using such a system. But also, ultimately, we need to also look at globally aligned approaches. And for instance, development of digital public goods, especially when we're developing these systems now. It's not just a case of developing an app and putting it out there. We have to think about tangibly what are the standards that a lot of the UN organizations put out there for us to, have a framework for moving forward. So a couple of the lessons that I just want to touch on very quickly in terms of development is that local context, and as I just said, we are actually, my team and I are actually building this from scratch, at least in the first phase. It's really non-negotiable for AI success. The collaboration here would build trust and insight. And of course, I always want to point out that the artificial intelligence is not meant to replace the traditional systems. We do have traditional systems, but we want to enhance them. And of course, we have a lot of persons who are very, I would say hesitant because they think AI is going to take over everything. And that's not the messaging that I want to portray in any way or form, because we can use it to improve our foresight and planning without replacing those human roles. We do need human insights. And of course, the sustainability requires training and capacity building, for instance, from events like this, and spiral it into other things where we could actually learn how to use systems, go into the public space and communities and teach them about these systems and really understand how we can, really, use AI for social good. So the future vision, and I have, just because I'm from the Caribbean community, I wanted to just give the context for the Caribbean community, but I think this can work across the board for any region, really, is that we want to be able to integrate AI into climate resilient health systems in different ways. There are different pillars to build that data, as we call infrastructure, as you could see in the flowchart here, and the skills needed, because even with my team, we have graduate students who are also now currently learning things like agentic AI and what that means for, the components that work on the back end. We need to build the skills as well. So the components will be the AI tools, the infrastructure, the stakeholders, the ethics and equity that's, important to these systems, and also the capacity building, and thinking about it as a governance model for maybe regional AI councils for climate and health, and just, implementation roadmaps as we go along, short term in 1 to 2 years, even midterm, if we can probably translate this into a regional platform and training hub. And I think SIHI is doing such a great job of really promoting these types of hubs, because it's much needed in different spaces. And I think can snowball from this. A lot of training can happen as well. And I want to also mention supporting open access to regional and climate health data and AI hubs is super important. And we also want to foster public partnerships, public-private academic partnerships as well. Because, as I said, it's really a diverse group of people must come together to ensure ethics and inclusivity. So just to end off, just to let you know that we will be trying to build a more AI, climate resilient future with AI. And this is, I saw somebody draw a nice little yellow line there. Thank you for pointing out my image, which is AI technologies, climate indicators, going funnel into the climate health initiatives. You could see how they kind of cascade one into the other, and then the health policies that emerge. So we can use the AI for smarter, faster, inclusive responses, but the Caribbean in itself, currently leading this type of work, can build more innovation and health resilient, secure futures. Of course, we also need to take into context the cost of the climate impacts, the investment for AI, because there's also an investment there in terms of costs, and then the long-term benefits. So this is the end of my talk. I would like to thank you and just end off by telling you that AI is not a silver bullet, but it is an important, powerful decision-making tool. And with a lot of collaboration regionally and internationally, we can move from vulnerability to resilience. And I left my contact information and also the website for some of the work that I do in the climate space, climate.lab.tt. So you can feel free to visit there if you want to see more about this project and some of the other projects that I work on. So thank you for your time and attention, and I look forward to any questions.
Thank you,
So
Dr. Letitia. That was a fantastic presentation. I see rounds of applause on the chat. Thanks, everyone. I think they are also agreeing with me. Yeah, and I think that the way you went through the presentation, from the gaps and how you thought of making this AI for SIDS platform and also towards the future, it was really inspiring. And of course, that's what we want to foster here in these talks, is for innovators to show their journey and to inspire ideas. And maybe to learn also from the different local contexts. Because here in the Philippines, we've had nonstop typhoons the past few weeks. And even though there have been early warning signs, the climate impacts have been really harsh. And so it's been really inspiring to hear what you've been doing in exploring these spaces and climate health, disaster preparedness, and AI. So maybe you can also tell us what kinds of backgrounds is your team or what kinds of people are in your team who are working on this, and what kinds of areas can we explore if you want to delve into this space?
Oh yes, definitely. Happy to share. I mean, my team has actually grown quite a bit. We started with about 3 to 4 graduate students from the Department of Computing and IT here at the university. So they have a lot of them have a data science and computing background. So we have a few of them are web developers who are able to help build the framework for the back end of the space, translate the actual idea into the algorithms and instructions needed. And we do have, yeah, we have a growing space of persons, even from engineering, and getting more persons in the geospatial area, persons who have been involved in consulting, and all of them are proud UWI graduates. So really happy to have about, I think we have about 7 to 8 of them currently. And that sort of expertise we have not in isolation. We have also, I would like to also point out that we have had a lot of mentorship over this year. Particularly, I'm very grateful from the COP29 on from the entire year from part as part of our prize. We had a lot of in-kind contributions in terms of mentorship for firstly the Enterprise Neurosystem, who was an integral part of that competition. They have a lot of IBM engineers. So we also had mentorship support in terms of having monthly meetings with them about the ideas that we have, having them tell us they have current black box models that can be used, but letting them know the challenges we face and that we need to build systems from scratch for this purpose, particularly because of the data gaps. And we also have some Google mentors as well. We did a Google sustainability program for 6 months as part of the prize, and we were able to learn from Google, even with Google has a very large flood hub as well. Currently not serving in terms of Trinidad data because same thing with the data gaps, they'll be serving a lot of countries, so we learn a lot from them. But in terms of our space, I think we might be pioneering in that area with respect to the data that we have. So we have a lot of players and mentors on the outside, and I'm really very proud of the team at the university because I think it showcases the talent and that, you know, the local talent could be used to build these types of systems.
Thanks so much, Dr. Letitia. Okay, so at this point, we're going to entertain some questions and comments. So please feel free to use the chat. And I see there are already a few here. Thank you, guys. So keep them coming. We'll go through as much as we can. So first, I'll just read this one from Mr. Sachin Ganpat. So there is a great inequity when it comes to AI resources and capital being available for small island developing states, in not only accessing hardware and processing power, but also in the availability of data. So how do we change this to harness AI to help us?
Yeah, that's really a definite issue that we face, and I think that and it's a very, very good question. My perspective of the problem is that we've had even before the AI systems, we've had these problems in terms of you know, types of resources, you know, having limitations with respect to certain resources, etc. Now, for AI resources, I would like to also caution that we have to first look at legislation as well before we just jump into building systems and putting them in public spaces. So that is also on board as well. I'm also simultaneously wearing another hat as a UNESCO consultant for an AI assessment for adoption in the country. So that in itself is helping me to also see what we currently face, as Sachin mentioned. And I think we have to start small. So for instance, one of the biggest things that will happen with AI systems, especially in smaller countries, we need to figure out what do we require? Because in terms of larger countries, they can build very large data centers and a lot of resources go into that, also impacting the environment. So I think what we try to do is do low cost solutions and open source solutions in probably as base levels of what can happen with the AI tools. And then, of course, we do have to get buy-in from the government as well. We do have to get buy-in from ministries, and funding is crucial. I mean, right now we're actually working as volunteers on this project with only in-kind support from mentorship, no clear capital. But of course, we have to showcase what can happen, and then we can probably get more funding. And of course, funding support is crucial for us to build out something larger. So I would say this is an ongoing problem with respect to maybe the inequity aspect, but working on these things and showcasing what they can do and what are the needs, I think can move us closer towards, you know, closing some of those gaps. Yeah.
Thank you, Dr. Letitia. Okay, let's move on to the next question or comment from Mr. Daniel Turay. So he says that you've outlined fantastic AI-driven initiatives for climate and health. His question is about impact evaluation. So how can we plan to move beyond correlation to prove causation? For instance, how will you know if your health intervention caused the improvement and not some other factor? So it's more on how you've been conducting your monitoring and evaluation.
Oh, yeah, definitely. And I must say, from the Google mentorship that we have done as well, that is a huge theory of change and really looking at the impacts before in terms of what we actually want to measure. So that is really very super important. And I think that what we have been currently doing as well is also doing some comparisons to what's going on in the international space with similar types of systems. But at this level, I can say personally for the system that we're working on, the first order of business for us to make this easy to measure is to first target the disaster management agencies. More specifically, our Office of Disaster Preparedness and Management. First, do testing there and get feedback on the usability of the system and how it can integrate with their current systems before we try to push this into a public space. So the end result is a public space to get the feedback. But in terms of the current level of what we will be evaluating and monitoring, it would be, is this working for those disaster professionals first? And then see how it is usable there, and then be able to go and do more public, because I think they are the ones who interface with the public, and they are the ones who would be able to assess at this point, based on very preliminary insights, if this is tangible, if this can work, if it needs to be improved, and then we can go and test with public users. So just to answer the question, this is something that's still emerging for us in terms of the progression to move from that correlation to causation, as you said, but it really is a lot of testing involved and feedback, especially when it comes to AI systems. Testing and usability is really important. And then, of course, thinking about the impacts and the areas that we could actually go into and really get some further feedback. So it's really a phased approach at this point. And then we'll be able to, even with the health systems, getting health professionals involved in testing the system, same thing. Getting that type of feedback and usability, and then looking at those results before we move forward. I want to make sure persons understand this is not a case where we're trying to do this blindly or too quickly. We want to ensure that it works at different stages and get that feedback before we try to do greater interventions.
Yeah, thank you, Dr. Letitia. Yeah, and I think also since you're still in the early phase, even despite that, you've outlined a great sort of timeline for the future on how you want to develop the platform and how the feedback loop will inform the what do you call this, the innovation when the time comes. So I guess what I'm getting for our early stage innovators also. It's important to plan for the future, but we have to take the precautionary steps to be sure to get there. Am I making sense? Okay.
Yes, I would sum up that by saying we have to walk before we run. So
yes. Okay. And someone here on the chat is also giving advice or a comment on what can be done via the feedback loop. So maybe your team can consider integration of active medical prophylaxis into your model. For example, evidence-based doxycycline for leptospirosis, which can be done via the feedback loop from the community and exposure risk. So, that's great for sharing your experience. Maybe you have anything to say, Dr. Letitia?
Yeah, definitely. And I think these types of use cases, once we sort of get an overall measure of, how the system works, the usability, and these types of things, we could go more intricately into different aspects and really get a context. So from the one that the use case that I gave for like South Trinidad as an example, yes, once we get that public health data, really funnel that sort of data into the system with maybe leptospirosis cases that happen after a flood, post-flood, and then do this over time. Because I mean, I'm a statistician by training as well, so we have to also, take the correct samples and do this type of testing over time. Yeah, we can definitely go and put more layers into it and really get more insights. So it's really a careful walk, I would say, but it's actually, I think, very progressive in that way, at least for our purposes, because we have to look at what we need currently and how we can progress with that. Yeah.
That's great. Okay. And Mr. Sachin also asked how you are maintaining funding for the platform, or maybe if I can also add is how do you plan to, scale
Yeah,
up the platform?
scale
So
up.
where do you foresee it being run, like the
Yeah.
government or still academic based?
That is an interesting question, and we are still having these conversations. I would say at the first outset, what we're currently doing is the first aim is to have it as an open source platform, at least for the disaster professionals to use. Now, the disaster risk management professionals in Trinidad sit under the Ministry of Homeland Security as part of a ministry within the government. They wouldn't be the only players that we want to also incorporate, maybe the Ministry of Rural Government, local and rural government, and these places, Ministry of Agriculture, etc. So funding in itself would definitely be hopefully some sort of partnerships from the universities and then also probably from the government or the ministries end, but that is something that would probably come after something larger happens. So I think once they see a working prototype, then we'll sort of be doing a sort of a road show, I would call it, in terms of trying to sell the aspects of what can occur and have them, integrate us into their work plans to be able to build something larger and get more funding. And of course, we're also trying to get independent funding as well to build it out larger. But for now, we're building an open source system. And then eventually, if we have to scale up, we will definitely have to, get some additional funding to do more. So we're just trying to build it at a level that's, that we can manage at this point, before trying to manage too many people and scale up as well. So that's really what we're trying to do. Yeah.
Great to hear, and I look forward to what will come next. Okay, so before I close the question and answer session, maybe Dr. Letitia or Dr. Lauren, you have anything final words to say before we close the session?
Oh, I will just put my information in on the climatelabb.tt website in the chat and then my LinkedIn, and that's it. And I thank you very much for this opportunity today. Really was a pleasure.
Yes, I just want to echo what Leticia said. Thank you all so much for giving us the opportunity to talk about some of the work and showcase what's happening here in the Caribbean. And we're looking forward to hearing more from Leticia and other SIHI talks in the upcoming year.
Okay, so thank you so much to you ladies. It was great hearing from you both. And of course, even though we're very so many miles and time zones apart, there's still so many similarities being from island countries and how pressing the challenge of climate resilience is. But I am so happy to have people like you who are very working diligently on um, closing these gaps. All right, so thank you everyone for a great discussion. But first, maybe Dr. Letitia and Dr. Lauren, can we take a photo? All right. I think Amara, can you just tell us if it's all right? Or Grace?
Okay, 1, 2, 3. Okay,
Oh,
okay, it's okay.
okay. Thank you so much. So thank you again to our speakers and thank you to our audience as well for participating and sharing your time and energy on whatever time it is where you are today. So we hope you keep supporting SIHI Talks. On the left side of the screen is a short survey to give us your feedback. And if you'd like to get in touch with um, SIHI Network or SIHI Caribbean, and then our lineup for 2026 will be announced soon. So we'll be resuming SIHI Talks next year. Thank you for all your support so far and those who have been diligently attending the monthly sessions. So if you'd like to know more about SIHI, please visit our website or any of the social media handles at the top level of the screen, and all previous SIHI Talks are uploaded on our YouTube channel. So once again, thank you so much for joining us and have a wonderful day. To get an access to a certificate of attendance, please scan the QR code and